We are officially done with the most hellish semester of my life. Columbia is one of the few dental schools in the country that does this. And then when it's prepped, you'll be able to see how much you've cut off. So it's going to be used to grade us. Blew it way out of proportion. There was actually like a whole Reddit thread basically bashing me for saying that. Hello, you guys. It is the start of our second to last week of school. Took our preclinical operative final earlier today. Right now I'm heading into preclinic to practice for the competency that we're going to be doing. Sorry, I'm out of breath. I just walked up a big hill. The competency this semester is a crown prep. Sees tomorrow afternoon. Really can't talk. Walking up a hill in the cold when you're an asthmatic is really not that fun. The two that we're working on is actually number 19 as opposed to 30, and that actually makes the crown prep slightly harder. I haven't practiced that side as much actually, so I'm gonna try to do 2 crown preps on that side today. So because that side is not immediately adjacent to you, it makes it a lot harder to visualize a lot of the structures. Also makes it harder to kind of position yourself. It does make it a little bit easier if you're a lefty, but there aren't that many lefties in our class, so I kind of showed it in an earlier vlog when we first learned how to do it, but hopefully my skills have gotten a little bit better since then. I'm not going to toot my own horn because I'm really rusty and I haven't been practicing nearly as much as I should be. The weather's been kind of all over the place lately. One day it'll be super warm, you don't even need a jacket, and then other days you have your fingers out and you feel like you're gonna get frostbite. I actually like the winter. I'm not dressed for it, like my fingers are freezing. I drove here so I didn't feel like wearing a warmer jacket, but probably should have dressed a little bit better for the weather. It is competency day. I'm headed in to grab my instruments, basic kit and instrument that I'm gonna use to polish my prep. Just grab my instruments. We're working on a crown prep and we get an hour and a half to do it, which is not a lot of time, but hopefully I'll be able to finish on time. I did what I could ahead of time, so I created my reduction guide, which I'll show you guys, which kind of allows you to measure how much you've taken off and also allows you to make sure that you're angling your prep the right way. I'm excited. Wish me luck. I'm just setting everything up. I have my Typodont with my reduction guide. It looks like this. You just basically take a mold of your unprepped teeth, and then when it's prepped, you'll be able to see how much you've cut off. So it's going to be used to grade us. So you could actually have to measure each dimension that you're reducing. Still never gets easier.
Are you ready to start?
Yes.
Okay. Start time will be...
Alrighty, just finished. I don't think it's perfect, but it'll have to do. One that I worked on. There's a crown prep on number 19. Not the most ideal crown prep, but honestly, not bad. A little bit over tapered on one of the sides, but hopefully that won't be a problem. Good morning, you guys. Yesterday, as you guys saw, we had our last competency of the semester. I think it went pretty well. I'm not too sure. I'm not extremely confident about it, but it's not the worst prep that I've ever done, so it's in the hands of my professor now. Today, we actually have an OSCE. And if you're familiar with like medical school curriculum, an OSCE is basically like an objective-based, I don't even know exactly what OSCE stands for, where you are presented with a situation and someone acts as a patient and tells you certain things, you know, like this hurts, this is my past medical history. You're supposed to kind of guide your activity based on that. Physical exam, the head and neck, the abdominal exam, we take vitals, a review of systems, and take medical history, and then we also have to write a quick note at the end. I'm most nervous about the head and neck exam because there's so many muscles and cranial nerves that you have to check for, and you have to make sure that there are no neural defects. And although it may seem overkill for a patient who is kind of like walking into the clinic, it's very necessary for someone who has, you know, just been in an accident and has come into the hospital. Although they may be, you know, walking and talking, there may be some underlying damage that you wouldn't know unless you specifically test for it. So that's the purpose of doing an OSCE like this. It's actually something that we would have to do when we're doing a residency that is hospital-based, such as a GPR or oral surgery or pediatrics. We will eventually have to do something like this. It's winter and it is extremely cold outside, and my lips are drier than the Sahara. I'm actually really excited to do an OSCE. You know, what we talked about in physical diagnosis is that patients are not great historians. Sometimes they will omit certain information, and let's say you are a resident and you are taking their medical history and history of pleasant illness, they may omit very important things, such as, medications that they're taking because they just forgot, certain symptoms that they may be experiencing, but they don't mention to you. They would just mention them at a second encounter. You gotta work with what you got. You also have to be diligent about the questions that you're asking. So if you take the patient's vitals and you notice that their blood pressure is extremely high, you would ask them, do you have a history of hypertension? Are you on any medications? Do you have them with you? Because hypertension is one of those big ones where if they're coming in for dental treatment, this is what always bothers me about people who say that dentistry is not medicine. Because if you are a patient with hypertension and you come in to get something as straightforward as getting a cavity filled, when we inject anesthesia, first line of treatment would be anesthesia with epinephrine or adrenaline. And one of the side effects of injecting intraoral epinephrine is what? Elevation of blood pressure. So patient with hypertension would be contraindicated to use anesthesia with epinephrine. So they would have to get something like mepivacaine, a type of anesthesia that does not include epinephrine. And the downside of that, it doesn't last as long and it's not as good at anesthetizing as lidocaine with epinephrine is, but you have to do it for patients who have a history of hypertension. But guess what? If they don't tell you that, and if you don't take their blood pressure, you would never know. You barely have the time, and you just kind of go into the treatment without actually going over vitals, and then you can put someone's health in danger. So obviously that's not putting blame on anyone. It's a combination of patients, especially if they're on a lot of medications, not necessarily remembering what medications they take. When providers are overworked, you may not always have time to take vitals. But the good thing about, coming to a hospital setting is one of the first things they'll do is they'll take, your heart rate, your blood pressure, your temperature in a way that avoids mistakes, covering your bases, even though it does take longer. So if you've ever been admitted to the hospital and you kind of wondered why it takes forever to get you admitted and into a patient room, it's probably why. They're taking your vitals, they're triaging you, seeing if you're critical, if there's anything that is like life-threatening, then kind of allocating resources and people accordingly. I actually had a situation where I talked about this on my channel. I ended up in the hospital last year in December. I was very, very sick and no one could figure out what was wrong with me. I went to the hospital twice, and both times I was there for probably around 12 hours. The more I learned about healthcare and the more I learned about triage and understand why I had to wait so long. As I was sitting there in the hallway on a hospital bed, I saw people being rolled in for an emergent delivery or people in a hypertensive crisis. Obviously, I'm not gonna take center stage when there are patients that are actually critical. Although it feels terrible to have to sit there and wait for someone to see you, and you may be going through multiple people that you have to tell your history to. The reason for why you have to tell it to the nurse, to the doctor, the residents. Patients are imperfect history tellers. So sometimes you may be telling someone for the first time about your history of illness and your medications, and then as you're telling it for the second time, you're like, oh wait, by the way, I take this other blue pill that I don't really know the name of, but I know that it's for so-and-so condition. So although I can understand patients' frustrations with increasing wait times, and the more I learn about the proper hospital procedure, the more I really understand how important it is to do all of the things that you may think are annoying and take forever, but are extremely necessary. So I'm gonna take a quick little break because I wanted to show you guys what Merit just sent me. Oh my gosh, I already took this out because I'm so excited. I already used a few of these products. So as I'm getting ready, a lot of the products that I'm using, bronzer that I just used, a little makeup bag that I always have with me because it's just so easy to kind of unwrap and see everything that you have. All of that is from Merit, and I've been loving their products. And so for the holidays, they actually have a bunch of sets that you can get on their website. Make it so easy because they're for different occasions. This one is called La Fête Edition. I think it's for the party season, which makes sense because it comes with, I just want to show you guys this highlighter. I mean, look at it. It's like a glazed donut. I mean, look at that. This is not gonna be your blinding, dazzling highlight. Merit is actually known for natural looking minimal makeup. As someone who is always busy and on the go, having something that is natural and minimal is so important to me. As you guys just saw, I don't wear foundation when I'm every day like in the clinic because I'm wearing a mask over it anyway, but I do have bronzer and concealer when I want to make my skin look a little bit more glowy and healthy. This is what I use. I don't know if you guys heard, but with the whole advent of like skincare makeup, the kind of like lit from within glow is coming back. So this set actually also comes with these glow drops, which you would use underneath your makeup. Gives you like a really nice dewy base. Also, the order from Merit, each first order gets one of these bags included, which is so cute because I have a bunch of like, zipper makeup bags that are like leather, and one, they're so heavy, and two, they take up so much space that I use this all the time because it's compact and it keeps everything together. I'm also gonna list the products that I used, including the bronzer, which if you guys haven't seen, it's like all over TikTok as like the easiest bronzer ever. I mean, I just put it on on and it gave me like the nicest glow without having to do much work, which is so nice. I actually love buying small mascaras. What a lot of people don't realize is that mascaras have an expiration date, and for most of them, they're 3 to 6 months. And I don't know about you guys, but I don't go through the mascara that quickly to go through an entire large tube in 3 to 6 months. So I really like getting small sizes to try out different products, see what works for me without 1, breaking the bank, and 2, wasting product because I have to toss it out after 3 months or 6 months. I'm busy in like pre-clinic and stuff. I don't wear makeup every day. I love Merit because they're vegan, they're cruelty free, so you can feel good about your purchase and about the products that you get. I think that the set is such a perfect gift for yourself. You're like me, you don't have too much time. This morning, get ready with me took about 10 minutes, so that's the most time that I have pretty much on any given day. I love using products that are easy and simple to put on. They don't take a lot of effort. I'm not by any stretch an expert on makeup. I do love using them to make my skin look amazing, even though half of it is going to be covered up by a mask. If you're interested in any of the products, I will leave a link in the description, and it is an affiliate link. If you guys do use it, it would really help me out, but again, you don't have to, and I will list all the products that I used down below. I am gonna go get dressed and then head to my OSCE. Okay, so I just got out of the OSCE. Oh my gosh, I did not think that I was gonna be so nervous. It was a resident playing a patient. That's why I can, talk about it. My patient was a male who had a basketball accident yesterday, and he noticed pain when he was biting and that his bite was off. Clinical finding was an intorsion of number 8, which means the tooth was like pushed back, which clearly means there's been some trauma. Patient's primary concern was the fact that he had trouble eating and also pain. So we had to do a full-on physical exam and a review of his entire medical record. I was kind of hoping that he had some past medical history, diseases, things like that I could like ask about, but he was kind of just like saying nothing. Wondering if I like didn't ask enough pointed questions to find out if he truly had a pre-existing condition that I didn't ask about. But the real trouble started when I actually started doing his physical exam. Everything was fine. I took his vitals, I listened to his heart and lung sounds, and really didn't know what I was listening to. I felt really bad because it was like I was taking so long to listen, and it was so hard because he was wearing like scrubs and also jacket, and he didn't really want to take them off, which I understand because he's doing this for like so many people today. I was trying really hard to listen. I think I listened in the right places, but it was just really hard to actually get any kind of sound coming through. I was really lucky because I actually had a digital blood pressure cuff, so I didn't have to do manual blood pressure or take his pulse, which is nice. And then I had to do a head and neck exam because he did have some trauma. He got hit in the face, and go through all the bones, go through all the nerves. Oh my gosh, that's what I forgot to ask. I forgot to check some of the cranial nerves. Wow. I just realized that as I was talking about it, I forgot to check his uvula, puffing out the cheeks and stuff, all the muscles of facial expression I forgot to check. Wow, that is really important. I just realized that mid-sentence that I forgot to ask about that. Aside from that, I checked all the bones in his head because he did have trauma. The problem was that when I was doing his intraoral exam, normally when someone comes in post-accident, we're supposed to check whether they have mobility in their maxilla, which is the upper jawbone. And the way that you do it is you grab their like nose to stabilize, and you kind of hold the middle of their upper jaw and kind of wiggle it around to see if there's any movement. And when I did that, I had forgotten that the patient's chief complaint was the fact that he got hit and was experiencing pain on tooth number 8, which is your central incisor. I felt really bad because the patient was like, well, yeah, remember? I got hit. That tooth was the one that was in pain. A little bit embarrassing because obviously in real life, I never want to hurt a patient more than they already are if they come to see me. I also felt like my hands were shaking when I was in the patient's mouth, even though this is not the first time I'm doing anything intraorally. Like when I worked as an assistant, we had to do temp crowns and things like that. So I've been inside a patient's mouth, if you want to say that, but my hands were still shaking when I was like checking the floor of his mouth and everything because I wanted to make sure that everything was good. I did do some of the cranial nerve checks, like, oh my god, I forgot to do the wow, I forgot to do so many things. Wow, not do the oculomotor muscles and nerves, and I did not do muscles of facial expression. I was wondering, I'm done too quickly. There should have been more that I should have done. I did check the pupillary light reflex, but I did not check the oculomotor nerves. You're supposed to like have the patient follow your finger. Oh my gosh, what else did I forget? Now I'm overthinking it. The course directors kind of talked to us and they were like, we don't want to fail anybody. We don't want to make you feel like doing something wrong, but we also want you to kind of know what you're doing when you actually end up doing this on a patient, because this is the last time we get to practice before we'll have to do this on a real patient. When those things are missed, they can make a big impact, especially if someone comes in post-severe accident, which obviously in this situation, you never know. I did check the bones. Like, it was top of mind for me because first thing I was thinking was a fracture. I just completely forgot about all the muscle. I'm gonna stop thinking about it because it's just gonna bother me now, but that is my live reaction to doing an OSCE. A lot of us were very nervous, and because there were just so many things that we had to worry about, I was talking to some of my classmates, they're like, oh my god, like I was so focused on like blood pressure that I forgot to listen for the heart and lung sounds, you know? It's okay, this is our first time doing this, and now I will never forget to check the muscles of facial expression and the oculomotor nerve. If you guys want to know, by the way, what the OSCE sort of looks like, I actually have a vlog where we were practicing for the OSCE, doing the head and neck exam actually, and one of my classmates was doing it on me. So if you guys wanted to see what this looked like, what we had to do for this exam, you can check out that vlog. It was a really fun day, and actually when I was the patient, the reason why I realized as I was driving back that I didn't do some of the things that I did was because I remember when my classmate was doing the exam on me, I remember like puffing out my cheeks, you know, sticking out my tongue, you know, examining the uvula and things like that, things that I forgot to do. Everything was just kind of so fast paced, and I also felt bad like taking up too much time doing any particular thing. Again, it's not like a super high stakes test, which I'm really happy about. After this, we now have only one more exam before we are officially done with the most hellish semester of my life. Cannot wait until we are done, because after this semester, we are done with all medical school classes, so we never have to worry about them again. That is it for me today. If you guys enjoyed this little snippet of what we do, if you were ever curious about a more medically integrated curriculum, I'm hoping that I was able to give you a little bit more information than what is already out there. Columbia is one of the few dental schools in the country that does this. It's not a very common thing. She had a whole controversy on my TikTok about this when I say that I'm a dental student in medical school, and people got so mad at me, especially medical students. I found that kind of funny because what I was saying was not an untrue statement, but people just blew it way out of proportion. There was actually like a whole Reddit thread basically bashing me for saying that. I truly did experience 3 semesters of medical school courses. I gotta say, I'm really grateful for it. I learned so much throughout the process, and it was a great experience, albeit it was extremely challenging because we had to juggle not only the medical school courses, but we also had to juggle our dental courses and our dental labs and things like that. So it was a lot. I'm glad that we got to experience it. In the moment, it didn't feel too great just because, especially these last couple of weeks, just a lot of exams and everything coming together at one time. Now that I'm done with the OSCE, I only have one more exam, and then I'm officially done with the semester. And that feels so good to say because I am halfway through my second year. Next semester, we're starting fully in our dental rotations. One thing at a time, one class at a time. It's gonna be such a nice change of pace, and I'm really excited about it. Okay, so I'm gonna wrap up this vlog right here. Thank you so much for watching. If you're still here, I really appreciate it. If you're not subscribed already, please subscribe so you don't miss any of my future uploads. And again, if you're interested in any of the makeup products that I used, click the link in the description and get a little treat for yourself or for a loved one. That will be all for me, and I actually found a parking spot. I'm so excited about that in my neighborhood. Thank you so much for watching, and I'll see you all in the next one.